Burgess, and we're glad to have you presiding today. Prescription drug and heroin abuse is a public health crisis, and it's growing every day. In many communities across the country, we're seeing an epidemic of opioid overdose deaths. I'm interested in learning from the panel about what more we can do to prevent the abuse of these drugs and also to save lives. The non-medical use of opioids has escalated in recent years. In 2011, the hospitals tallied nearly 500,000 emergency room visits related to these medications. The number of these visits nearly tripled over a 7-year period. The link between prescription opioid use and heroin abuse is also deeply troubling. And as the chairman noted, only a small percentage of people who use pain relievers go on to abuse heroin, but the opposite is not true. The vast majority of those who abuse heroin previously abused prescription drugs. While far more people continue to abuse prescription drugs, the number of individuals who reported using heroin nearly doubled between 2007 and 2012. There's also evidence to suggest that people who abuse prescription drugs move on to heroin as pain relievers become less available or too costly. A 2012 study in the New England Journal of Medicine found heroin use rose dramatically after the introduction of an abuse deterrent form of OxyContin. The use of drugs that ultimately lead to addiction and abuse often begins innocently. The majority of people who illegally use a prescription drug get that drug from a friend or a family member often, and sometimes the drug has been stolen, but in other times a parent may even give the drug to a child unaware of the risks. We must educate patients on the dangers of abuse of these drugs, as well as the need to properly store and dispose of them. If we can reduce inappropriate access to drugs, we can also reduce the incidence of their abuse. We must change the public perception of the prescription opioids. We face the inaccurate perception that just because a drug is legal, it is somehow less harmless, less addictive, and less risky. Providers should also be better educated on the use and potential abuse of these drugs so they can be more effective in recognizing problems of abuse and in turn more effective in educating and treating the patients. Studies show that even brief interventions by healthcare providers can be successful in reducing or eliminating substance abuse by patients who begin abusing prescription opioids but have not yet become addicted to them. When prescribed appropriately, these medicines provide much-needed relief, and many patients have had their suffering reduced by opioid painkillers. However, a patient with an acute short-term pain may be able to find relief from a less addictive painkiller. Prescription drug abuse is a public health problem, and it's not just a law enforcement problem. Reducing this abuse will require a multifaceted approach and partnership among federal, state, and local agencies. Every state should effectively use prescription drug monitoring programs. These databases help states identify and address drug diversion, so they should be as robust and effective as possible. States should be able to share information with due regard for privacy expectations. Information should be added to the databases regularly, including by encouraging prescribers and pharmacists to use the databases. When used, they can help doctors and public health authorities prevent and respond to the potential devastating effects of prescription drug abuse. I'm interested in learning from our witnesses today about the effects of this medication-assisted treatment that we're hearing about, and also whether we have the resources to meet the demand for these treatment programs. I'm also interested in learning about the state of research into new medications with lower abuse potential and how we can expand access to overdose interventions like Naloxone. Prescription opioid and heroin abuse, as you said, Mr. Chairman, is a serious public health threat. I look forward to hearing from all of the witnesses and to working with all of my colleagues on both sides of the aisle to ensure that Congress plays a vital role in protecting families from the growing danger of these drugs, and I yield back the balance of my time.
The gentlelady yields back. The chair now recognizes the gentlelady from Tennessee, 5 minutes.